Hello, everyone. I can see a lot of familiar faces: Dr. Ehsan, Dr. Anita, Dr. Anupama. Thank you so much for joining us today. So, we have Dr. Farhat with us for today's webinar. We are going to discuss how we are going to prepare for the AMC exam, and also we're going to solve some recall questions. So, I would really like to request Dr. Farhat, can you please continue with the webinar?
Hello, everyone. Can you hear me? Hello?
Yes, Dr. Farhat, you are audible.
All right, that's
Hello,
good.
Dr. Farhat.
Yes,
Yeah,
I can
you
hear
can
you.
start.
Thank you very much. Hello, everyone. I hope you're doing good. My name is Dr. Farhat Joya, and I'm your mentor for today's class. And we are going to solve some recalls at the end. And first, I would like to give you some information about the AMC exam and how to pass the exam. And there are some key points that we are going to discuss. So today's webinar session is only 1 hour, like that's 60 minutes. And but we will try to use it as much as we can and discuss as much as we can today. So let's see, first of all, so there are some rules. Please, everyone, if you can keep your mics, with your microphones like silent and mute yourself because that will be disruption for everyone. So I don't want that. And if you have any question at the end of like every sector or session, I'll give you few minutes that we can discuss your questions. So like I'm not going to solve a question after each recall because that will take a lot of time and I don't want to waste other people's time either. So if you're ready, so we are going to start our session. All right. So if you're ready, so give a thumbs up. That I should know, and we will continue. All right. So you can write your answers in the chat box, or you can write it on your page of paper in front of yourself. The answer for the recalls. So let's go. All right, that's great. First of all, so we do have MCQ exam, and hopefully everybody can pass this exam. There is some information about the exam. So as you know already, the exam is 3.5 hours. That's like I think around 210 minutes, and you have 1 to 50 questions to solve, and you have around like 84 seconds for each question, and that's more than enough. But please practice to that. Practice as much as you can that you can read it as fast as possible, like scan with your eyes and scan the key points as well. So we do have like questions like about like 30% of the question is about the adult health, and we have 20% for the surgery. And all right, so we have 12.5%. We have hopes and gynae, and we have like pediatric, 12.5%. Mental health, that's psychiatry, 12.5%. And we have population health, and 12.5%. So it's like 150 questions in total, and you have 210 minutes. All right. So let's go to the next slide. So these are the books that you can use if you want. So we have many books here for you guys. So we do have like adult emergency medicine. We have on-call book. You can download it from internet or you can buy the hard copy if you want. RSC pediatric handbook. This book is very nice. And we do have like a textbook for the surgery of healing. But if you don't have a lot of time to go through all this book, I know it's very stressing. So you can just do the recall crash courses, and that's very helpful. But please read the handbook, AMC handbook, and John Moffat. That's a must. All right. So we do have here AMC handbook. This is the famous blue book that we are talking about, John Moffat. So now we have the 8th edition is out. If you want, you can read it. And we have this old book, and usually it is not very useful nowadays, but it is always nice to look at the pictures because they have some nice pictures, and the pictures will appear in the exam. And there are some old classic questions over here as well. We do have the higher Oxford handbook as well for you guys. All right. So we do have the Kaplan. Yes, Emily is useful as always. So we do have some guidelines in internet, like whenever you want to search for any topics, you can use these guidelines. At the end, I'm going to share these slides with you guys that you can have it. So that will be much easier for you because it's a lot of information to remember everything at once at the moment. So we do have like emergency care institution and we have like RHCP, we have RSCGP. So all of them, you can go through it, and Medscape is always has been a nice guide for everyone here. So there are some tips that we can follow. All right. Okay. So do not underestimate the exam. That's one thing that I'm telling you. And there is a lot of my friends, they have been very good doctors for a while, but what is the problem that they say, okay, we have passed our own country's board exam, and that was pretty tough. I'm going to pass AMC at once. That's not going to work, guys. And all of them who thought like this have failed their first attempt. So I don't want you guys to experience the same thing. So follow Australian guidelines, all right? Do not follow American, do not follow New Zealand, but follow Australian. Just go for Australian because you are going to work in Australia. Time management, as we discussed already, we have how many seconds? 84 seconds for each question. So please make sure that you read fast and you do not waste your time. Practice the questions. Practice as many questions as you can. And when you practice, it is not always about the quantity, it's about the quality. Just remember, and you have to remember the answers, you have to remember the explanations. Okay. So there are some tips for AMC. Yeah. Okay. First of all, we do have like focus and targeted approach. Do not use a lot of websites. I mean, like 10, 15 websites and get yourself confused. Do not use like 20 resources and get yourself confused. Stick to one, please, or like at least like you can maximum 5 resources. That's it. And study all topics. Okay, you cannot skip. Okay, let's see. I hate pediatric. I don't want to study that. That's not going to work. Even though you hate it, you have to sacrifice. You have to study, and you have to do your best. We do have like topic-wise approach. It is always has been nice. It will keep your notes neat and clean. And topic-wise approach is one of the best approaches because you know which topic you have done, which topics you have not done it. All right. So remember, etiology is important. Investigations, like which is the first investigation, which is the second choice investigation. Management is always the tricky. What is your next step? What is the most appropriate step? And what is the second best step? We have done, for example, we have given the patient IV fluid already. What is your next step of management? So management has been very tricky. So please make sure that you study it very well. So we do have some questions for AMC. So we do have like some recalls. After some recalls, we will do it quickly. So if you guys have any questions, feel free to ask me now before we start our recall questions, guys. You can unmute yourself and you can ask me if there is any question about the topics that we have discussed until here. All right. Okay, I think everything is clear, so there is no question. So let's do our recall. So for this, you can write your answers in the chat box if you want. But if you're not feeling comfortable to write your answer in the chat box, what you do is that you can write your answer on a page of paper, and you can and what you do is that you have to at least do, let's see, like 10 questions you have to solve it. Okay. So we are going to discuss about the, like how many months of recalls, everything at the end of the slide. So we will tell you like which type of classes we do offer for you guys. So thank you for asking. So we are going to discuss it at the end, all right? Okay, there is another question from Dr. Ma. I find John Moffat very hard to completely study from. Some topics is not there, and most of them are okay. John Moffat is the basic. Okay, you have to study it, whatever it is. You have to go through John Moffat. It is hard. It's too much. It's difficult. You have to do it. No worries. There is no way that you can pass this exam without John Moffat. There is no way that you can find job in Australia without John Moffat. For AMC Clinical, AMC MCQ, you have to go through John Moffat, all right? Okay. Okay, we are going to discuss about the cubing, like which cubing that you should focus on. Okay, we can do this at the end. If you have any question for this type of question, like which cubing, which resources, so we can do it. We can discuss at the end. So for now, let's do our recalls, and we are coming back to you. Okay. All right, guys. Let's do our first question now. Okay. So this is our first question. That's general medicine. So I'll give you 30 seconds. So once 30 seconds over, so I'll check my chat box now. Please type your answer in the chat box, okay? Okay, guys, few seconds left. Hurry up, guys. Do not overthink. I can see most of you are with endoscopy. All right. You are somehow right, but in other, like, as you know, first thing, let me tell you about the recall, okay? The recalls are the recall. Like, we have anxious people, anxious doctors who give the exam and come back from the exam and they remember like 20% of the question, and that's, and they'll just tell you about the recalls, and that's very difficult. And sometimes they just come with one sentence. That's not enough. So most of the question you have is like a paragraph or half of the paragraph. So this is like short, but we try to solve it as much as possible, like give some reasons. Okay, I see that most people say like and send for endoscopy. You are somehow right, but when you want to send for endoscopy, you have to know like for how long the patient is using, or is the patient has epigastric pain, for how long the patient has been having epigastric pain, and as well like if they have done any endoscopy before. But since we don't have that information, so we just assume that it is a normal epigastric pain and it is not a complicated one. So if you think that will be complicated, so you go with endoscopy. All right. So, but B and C, they are wrong. We don't do ultrasound. Serum lipase is for pancreatitis. It is out of our range at the moment. That's wrong also here. So for the moment, we continue with esomeprazole for at least 3 more months, and we ask the patient to come back if the symptoms worsen, if the symptoms is not relieving. All right. So the answer for this one is continue with esomeprazole. Okay, let's go to our next question, guys. Please, I want you to type your answer as fast as possible, all right? Yeah, double the dose. You can do that if you have an option. Okay, guys, so this is your question. 30 seconds. Come on, guys, hurry up. You have to be very fast because in the exam you do not have this type of short questions. We have almost a paragraph. So this type of question that we are solving, you have to solve it in like 20 seconds. All right. All right. Very good. Very good. I see C. Most of you guys answer C and some answer D. Okay. Okay. 30 seconds up. Okay. Let's read it quickly. Okay. So you see, first of all, it's child. It's very important. You have to know if it's adult, child, elderly. Excessive vomiting. Okay. Several times with abdominal pain. No feature of diarrhea. Fingerprint test, glucose is normal. Okay. So what is the immediate danger to him? Okay, the patient has been doing vomiting, guys. Vomiting, always losing electrolytes. All right, diarrhea, vomiting. I don't know why some of you chose like hyperkalemia, because you're losing. But okay. losing potassium, losing salt, losing everything. So the patient will have hypokalemia. Most of you answered correctly. That's great. I'm so happy for you guys. Okay, so let's do, this is some of from John Moffat. I tried to bring everything from John Moffat to make it easier for you guys. So there are complications of vomiting, guys. Dehydration, obviously, especially in children and elderly, you have to notice dehydration is very important. Metabolic alkalosis, hypokalemia, here you are. Aspiration pneumonia. We do have mucosal tear. Okay, rupture of esophagus or House syndrome. Okay, the first line of management quickly. Okay, IV fluid without any wasting time. Correct the electrolyte. All right. So find the underlying cause and treat it. Okay. Give anti-emetic. But here, do you give oral or IV? That's the question, guys. Write your answer here for me. Oral or IV? Anti-emetic, guys. Okay. Only one person IV. How about the others? Okay, good, good, very good. We do give IV. Okay, that's very good. So this is from the John Moffat. You can read it later on. Okay. So we have now our next question. This is the next question. 30 seconds, guys. Okay, I'm waiting for your answers. Hurry up, guys. Time is ticking. Okay, good. Okay. All right. Thank you. Thank you. We have one C. Okay, and most of you with okay, I can see there are more C's are coming. Okay, good. That's much better, guys. All right. Okay, that's it. Okay, guys, let's see. You do have urgency and nocturia in elderly woman, and she has osteoarthritis, bilateral knee osteoarthritis. Means she cannot walk very well. Okay. We do have like formal pharmacological management, and we do have like lifestyle management. So, or non-pharmacological management. These are the non-pharmacological management. So you can do it whenever, but these are not our main management, guys. So we want to treat it first with oxybutynin. Okay, give this to the patient beside this medication. So you can say like restrict fluid intake at night. Okay, install a washroom or a commode in your bedroom, or if you want like there are many things that you can do, like fix the lighting, because elderly people with osteoarthritis, they tend to fall and injure themselves if she's living in the second floor. So encourage her to sleep in the first floor, avoid using stairs because in the middle of the night she feels sleepy. We don't want her to fall down, okay? And remove loose carpet if she has any like pets. It is very important. Like sometimes the pets you have seen it many times, maybe in the videos. Like pets makes you to fall down. So these are all the lifestyle modifications. But first we need medication. Okay, we give this medication for our patient. You see, it's oxybutynin, guys. So what is the trick here? The trick is to understand what they want from you. You guys chose these two. You're not wrong. You're not wrong. That's right. Absolutely. But we want the best management, guys. Understand the question. Best management. All right. So that's the issue. So you have to read the question carefully and know what they want from you. Okay. So this is correct. This is correct. But which one is more correct? Oxybutynin is more correct. All right. So I've collected some information for you guys. Just a quick recap. I know you know it already, but it's just a quick recap. We do have overactive bladder. That's due to the muscle instability. So that's the commonest urge incontinence, guys. All right. So the bladder could be irritable, unstable bladder. And what is the symptoms? Urge, sudden urge to urinate. You might be sleeping and sometimes like, oh, I have to go to washroom and I have to run to washroom. Okay, so we do have different types. We have functional incontinence. It is very important to know these, guys. You get a lot of question in MCQ, like they trick you, okay? Because sometimes these incontinences they overlap each other. So what you do? Okay, you have to know which one is what. So we do have like functional incontinence, loss of urine, secondary factors. We do have like secondary extrinsic factors such as UTI. Okay. Okay, we do have nocturnal enuresis, bedwetting, usually in children, but you can have in elderly as well. Overactive bladder, which is the most common type, okay? The commonest. All right. We do have overflow incontinence. What does it mean? It means escape of urine following poor bladder emptying. Stress incontinence, the patient laughs, coughs, sneezes, and also urinate themselves because they lose control over urine. Whatever they do, like, increase the intra-abdominal pressure. So like if we cough, sneeze, our intra-abdominal pressure increase, but we do have control. We don't urinate on ourselves. But people with urge incontinence, like stress incontinence, they don't have control over it, involuntary lose of urine. We do have urge incontinence, you know it, urgent. Urge for urgent, you have to run, guys. Urinary incontinence, involuntary lose of urine during the day and night. So it doesn't matter. It is urinary incontinence. It is present all the time. Voiding dysfunction, the patient cannot void it very well. Why? Because it could be, this is very common in male. B, benign prostatic hypertrophy, BPH, guys. Okay. Let's go to our next question. So I want to see your answer within 30 seconds, guys. I see different answers. F, D, This one is very tricky, guys. Okay, I have many F's. Okay, C, D. Wow. Okay. All right. That's it. Time's up, guys. So if you send me any answer, I will not accept it anymore. Okay. Time is up. Okay. You have to be quick and fast. All right. Let's read it. Okay. We have a diabetic patient with a foot ulcer. Very common in diabetic patient. Non-healing ulcer, guys. Okay. We have two pictures in medial malleolus. Okay. On the foot. Pulses are not palpable, guys. Look at this one. This is the key point. In this question, this is the key point. Ulcer and this thing, they are the key point, but this is very important. Pulses are not palpable. X-ray already done. What is the next management, guys? I think now you're going to change your answer. Okay, so let's discuss this for a while. Okay, those who answer F was correct. And those who answer like venous Doppler, I wanted to reread the question. Pulses are not palpable. Take a swab, blood culture. Obviously, you can do it if you suspect any bacterial infection. If you suspect any discharge, you can do that. Blood culture, swab. If you don't see any pus, it's irrelevant. The patient does not have fever, nothing. And why you take swab for what? Nothing. Okay. Venous Doppler. Yes, this would be correct if you do not have this one. MRI of the foot. You can do that if it gets very complicated. If you think that the ulcers become very deep in with the bone and other soft tissues. But for now, arterial Doppler. Why? Because we cannot palpate the pulse. We want to see what is going on, what is wrong with the arteries. All right. All right. Some information here. We do have venous ulcer between two malleoli at the lower half of the calf, lower part of the calf. It is shallow, irregular granulation base, okay, edema, and it is painless. We do have arterial, painful. That's the difference, okay, painful. We have, okay, the site may sometimes confuse you, but okay, below the ankle in the distal part. Okay, so it is usually dry, but this one has edema, venous has edema. We do have vasculitis. We do have ulcer due to vasculitis, rheumatoid arthritis, polyarthritis nodosa. This is not very important at the moment. Malignancies, basal cell carcinoma, squamous cell carcinoma, melanoma. We do have Mergelin ulcer. Okay, neuropathic. We do have in diabetic patients. Okay, let's move down and learn something from John Montauk. Okay, first of all, look at here. The great majority of the leg ulcer are vascular origin. Okay, due to arterial insufficiency or venous hypertension, guys. It's very important, key point. Okay, so now let's go down. Okay, so you can read it by yourself, okay? I'm just going to point the important points here because of the time limit at the moment that we are having. Consider biopsy when, because whenever it becomes hypergranulated and you suspect that it is nasty changes and the ulcers are non-healing for a while. Okay, look at here. Bacteria, guys who want to do swab. Bacteria swabs are unhelpful because all the chronic ulcer will become colonized with both gram-positive and gram-negative bacteria. Okay, hopefully you got a good clue about this one. Let's go to the next question, guys. 30 seconds, the clock is ticking. I hope it's not like this, that the first person who answers and everybody will follow the first answer. So please remember, the first answer might not be correct or might be correct. We don't know. So do not follow it, okay? Just do your own stuff. Okay, now I'm seeing different ones. Okay, that's much better. We do have E. Okay. What else, guys? D and E. I want to see more answers. 10 seconds. A. Okay. Okay, time is up. Okay. So just in the exam, you have to read the question like this, okay? Patient's history of pancreatitis. Okay, one key point. I just remember it. Okay, some time ago. Okay. But in the exam, the question will be much clearer, like they will give you exact time. 1 year ago, 2 years ago. Okay. Now presented with distension and tenderness, visible vessels. Visible vessels on percussion. This is our key point, guys. You have to remember visible vessels. Okay. The temperature is normal, means there is no infection. Liver enzymes are raised. Patient is confused, slightly drowsy. What is the diagnosis? So, liver enzymes raised, So it means that we have to look towards the liver and towards the gallbladder. Whatever it is, it's somewhere here because the liver enzymes are raised. Okay, the patient is confused because of this. Okay, pancreatitis is out because he had pancreatitis already. So if pancreatitis, so why the liver enzyme is raised? So in the exam, they will not give you like ambiguous questions. The questions might confuse you, but it's not ambiguous. It's very clear. Alcoholic cirrhosis. I saw somebody who said like C. Why not this one? Because where is alcohol? There is no alcohol. I cannot see any alcohol. Okay. Spontaneous bacterial peritonitis. Some people said this one. Okay. Peritonitis, infection. Why the temperature is 37.5, guys? It's normal, isn't it? So you have to be careful in the exam, guys. Pancreatic cirrhosis. I can think about this one. And somebody told me bad carry as well. Okay, very good. So let's discuss which one is what. Okay, the answer is bad carry syndrome. Okay, why? Because we do have pancreatic cirrhosis. For example, let's see, this is our pancreas. We do have our cirrhosis here. Pancreas. We do have our cirrhosis. We do have our liver. So pancreatic cirrhosis, if it gets so large that it compresses the liver and disturbs the liver, and the liver enzyme will be raised, and you will see that the vessels that is going to the liver, coming out of the liver, hepatic veins, they will be compressed. That is very unusual, guys. It is very unusual. It is very rare. So that's why pancreatic cirrhosis is out of our list. So we go with the simple, most famous, but Chiari syndrome. Okay. So let's see. Okay, this is the famous Budd-Chiari syndrome. Let's look at here. There is something, we don't know what, obstruction, causing obstruction, okay, to the hepatic vein and cause distended veins. Look at these veins here. Look at this. It doesn't look normal to me. It doesn't look normal to me because there's a thrombus blocking, so distorted, distended veins. That's why our answer is Budd-Chiari guys. Okay, let's go to our next 30 seconds. Ten seconds left. Okay, guys, we have to be quick, okay? All right, I can see A. Okay, this is pretty straightforward, guys. I don't expect you to give me wrong answer for this one. Come on, guys, please. I see that you all choose A. Okay, now we are going to discuss it. Okay, patient with COPD, quit smoking. Okay, tried 4 times before, non-relevant to us. We don't care. Okay, what we care about is that they feel restless, agitated. Why? Okay, what is the indication for this? Okay, we do have indication withdrawal symptoms. We do have withdrawal symptoms. We have duration of the disease. Okay, patient with COPD, duration of the disease, whatever it is, it will not make you restless, okay, unless you have obstruction and you cannot breathe. Family history of smoking, wow, okay. Obesity, flare-up, it could be flare-up, okay, it could be withdrawal symptom. But flare-up, what it will give you? Shortness of breath, plus cough, a lot of sputum. The patient talks with monosyllabic, like you cannot even say one sentence. That's why we do have the withdrawal symptoms. Okay, so we do have the withdrawal symptoms. Let's see. Okay, we do have withdrawal effect. Okay, the patient feels restless, craving for the smoking cigarette, hunger, irritability, poor concentration, headache, frustration. So this is from John Moffatt, guys. You have to remember all of them. It's very easy. So difficulty concentrating, increase appetite. When increase appetite, it will lead to increase BMI. Okay. Depressed mood, it happens a lot. Like we do experience this as well with people who drink a lot of coffee. Okay, if you do not drink your coffee for 1 or 2 days, you will feel depressed. So it's okay, withdrawal symptoms, guys. So we are done with medicine. Okay, I'll give you 30 seconds for the question, guys. No question? Good. Okay, let's do psychiatry. Psychiatry is very exciting. I love psychiatry, guys. I don't know how about you guys, but let's see how it goes. And I'll see how much you love it, the way that you will answer it, how fast you can answer it. Okay, sure. I'll share my email with you guys. No worries. And even I can share my WhatsApp and we can make a WhatsApp group and you can share your questions there. I'll try to answer as many questions as possible in the WhatsApp group. I'll be always there for you guys. No worries. Okay, so let's start. This is our question, 30 seconds, guys. Okay, very good. I can see a lot of people answered this question very fast. Okay. Somebody answered B. Yeah, I'm not sure about it. A, okay. Increase breast milk. Okay, breastfeed. Okay, time is up. Let's discuss this. Okay, mother is worried about excessive weight gain in a baby. There's 100-gram weight increase in 1 week. 100 grams, guys. That's not too much. Okay, excessive weight gain. Look, it does not even make sense. This is different, this is different. But what we think, psychiatry, guys, you have to think like a psychologist here. Worried. The mother is worried. Why worried? Should not be worried about it, okay? Restless. Why restless? Should not be restless. Tired. Okay, so that's why what you're going to be looking for is A is wrong. Increase the breastfeed. It does not make sense, isn't it? Formula feed does not make sense. Refer him to lactation consultant. No, because she's not complaining of breastfeeding problem. She's not complaining of the pain in the breast. Because we do have some technique, like you have to teach the correct way of teaching the feeding to the mother, like especially to the mothers who have their first child. That's why they will send for consultant, but that's not the issue here. Hospitalize the patient? No, because she's not going to harm herself or her baby. So it's all right. So we do have C. Assess her about postnatal depression. It is very common, guys. Postnatal depression is very common. So you have to think about it. Okay, we do have C. Okay, good. So this is again from John Moffat, guys. We have like the mother comes after 2 weeks to your clinic for assessing her like postnatal consultation. So what you have to look for, John Moffat says, take a good birth history of the baby, perinatal complication, ask the mother. Check her blood pressure. Why? Because usually they will have high blood pressure after the birth. This complication of the pregnancy, weight gain, her weight. See if she's losing weight or she has been gained excessive weight. Assess for adjusting to the motherhood, guys. This is our psychiatry. Symptom postpartum depression. Look, okay. If she complains of anything else, encourage and advise the breastfeeding technique. We do have a lot of questions in AMC about this one, breastfeeding problems. Okay, so you have to know about this one, postpartum blues. We do have like in the first 2 weeks of after delivering the baby. We do have like postpartum depression. It's first 6 months of postpartum, 6 months, guys. We do have postpartum psychosis. That's the most dangerous one. In this case, postpartum psychosis, you have to hospitalize the patient against their will. In Australia, we can do that. Okay? We call it like Mental Health Act. Under Mental Health Act, we can hospitalize the patient in the hospital because they are going to harm themselves. They are going to harm somebody else. So they have hallucination, delusion, suicidal ideation, homicidal ideation. So it's very dangerous. Okay, let's go to our next question. 30 seconds. Okay, 30 seconds up. Let's read the question together. Okay, we do have 23-year-old. Chaotic, anxious, and agitated. Multiple wrist lacerations. 1 key point. 2 key points. This happens post-breakup. 3 key points. Why it happened? Post-breakup with boyfriend. Admitted. Shouts on nurses. Okay. Found with inflated BP apparatus around her neck. Very weird. But okay, it happens. Okay. So what is the answer? Passive aggression? No. Schizophrenia? No. Because the patient does not have hallucination, delusion, nothing. Okay. Junior attempt to commit suicide? No. Because if she wanted to kill herself, she could have done it many times. Because she has had multiple attempts. Okay. Acute psychosis? That could be, but in acute psychosis, we have hallucination and delusion. We don't have it here. So, borderline personality disorder, guys, psychiatry. Let's see if we are correct or we are correct. Let's move down. All right, we are right. Okay, borderline personality disorder. These are the symptoms of borderline personality disorder, guys. Okay, look here. Difficulty in interpersonal relationship, problem with self-identity and self-compassion, suicidal ideation, and behaves, self-harm behavior, cutting themselves, taking pills. Okay, impulsive, risky behavior, mood swing. One day she's good, the day after she's like acting that you have never known her, feeling emptiness, fear of abandonment, anger outbursts. Okay, but what is the most important? We cannot obviously remember all of them. That would be a bit difficult. So what is the most important one? Interpersonal relationship difficulties, problem with self-identity, suicidal ideation, impulsive and risky behavior. That's it. Just remember this. You're good to go. Our next question, guys. 20 seconds. No, post breakup, it is not normal to cut yourself or try to kill yourself after breaking up with someone. Okay, guys, time is up. Okay, post-op agitated. Okay, the patient has done surgery, 3rd day. Okay, why agitated? Because he has been drinking 4 to 6 cans of beer every day. He smoked 20 cigarettes per day. Okay, patient tried to remove the IV line because he's agitated. The patient has kind of like delirium. He does not know what is going on. So let me see. Okay, most of you have answered A. Drug reaction. That's not relevant at the moment because it's the 3rd day post-op. If there's any drug reaction, you can see it in the 1st day. Special drug reaction, we don't we mean like anesthesia. We don't want, we don't say or think about any antibiotics here. That's why his third day drug reaction is out. Psychosis, it could be, but out of nowhere, how the patient can act like a psycho. Dementia, that could be dementia. Yeah, if you had an elderly, like 90 years old, 80 years old, and they give you some other history, like he has some memory problem, like short-term memory problems, long-term memory problems, they give you some other complication. Yes, you can do dementia. But at the moment, we do have, it's very clear cut. Alcohol withdrawal. Let's check the answer. Yes. Okay. Okay, this is again from John Mutford. In a fitting aggressive patient, alcohol withdrawal is the commonest cause. Okay, possibility of petrol sniffing should be also considered. John Mutford. Okay. So this is for your information. I've just put it here. Okay, this is the management. That if you get the answer like what is the management? First of all, okay, hospitalize the patient. Why? Because you don't want the patient to harm himself or other people. Correct the IV fluid and electrolyte imbalance as soon as possible. Okay. Treat symptomatic infection. We give like thiamine. We have like first of all we have to give thiamine. Then we have like diazepam, guys. Then you have to give diazepam. Why? Because the patient is agitated. The patient will not allow you to treat him if you don't give him diazepam. Okay. So let's see. This is the next question, guys. 30 seconds. Come on, hurry up, guys. I want to see your answer as soon as you can. Practice to be fast. All right, guys. Let's do this. We have alcoholism patients. Okay, surgery has been done. Femoral hernia. Okay, 4 hours, become agitated. Respiratory is 68%. And we have given oxygen by mask. Okay, let's see. It is very like we have discussed this already. Like the management was above the diazepam. Why? Because you want the patient to calm down. Okay. So anticoagulant, antibiotic, IV fluid. This is not the options at the moment. Okay. Our next question, guys. Hurry up. 30 seconds. Okay, this is kind of similar question that we have discussed already, but I just give it on purpose because I've seen some recallers who have brought this type of question like agitated recallers. That's what I call. Okay, so look at here. This is the same. We don't have any diazepam. That should be our answer, isn't it? But we don't have it. So what should we do? Choose the best option. Okay. So you do the exclusion method. Antibiotic, no. IV fluid, no. Anticoagulant does not make sense. Okay, I think this will make sense. I'm not sure if it's right or wrong, but this will make more sense out of these 4 options. Option C is more sensible. So let's check it. Yes. Okay, this is your answer, guys. We do have the next question. 30 seconds, guys. This one is very tricky, guys. 30 seconds up. So we have, even though it's like psychiatry, but we have to be very careful sometimes, okay? Because we have secondary causes of psychiatry. Like the patient have like some psychiatry symptoms. Okay, look at here. The patient is feeling that something is in his body. I really don't understand what the recaller mean by this, but that's what we got. We have to sort it out. What does it mean, okay? But what do we have? Patient is anxious and the blood pressure is high. Why? Because normal is 120/80, guys. Come on. It is high. Okay. So when the blood pressure is high, you have to investigate why it is high. Okay. So because this one, something is in his body, I don't understand. That's why I'm not going. But I'm looking for anxiety and BP. That's what I'm understanding out of this recall. Okay. IV, check IV cholesterol? No. Why should I check? I don't have any clue about that one. Psychiatric counseling? No, because I really don't know what he's feeling something is in my body. I really don't know. Okay? Like if the patient is feeling tired, if the patient has any lump in his body, if the patient has any hernia, I don't know. If the patient has hallucination, I don't know. So that's why. So we do pheochromocytoma, guys. Okay? Let's see. All right, this is pheochromocytoma. Why? In pheochromocytoma, you have the patient being sweaty, anxious, and high blood pressure. That's what we have. Okay, so you have to be very smart sometimes. All right, we do have OBGYN. Let's do quickly. Do OBGYN. OBGYN is always interesting, guys. Okay, 30 seconds. Hurry up, I'll check the chat box. Okay, I can see many options. Selling C. Okay, guys, very good. You are quick enough. Very good. 30 seconds up. Okay, so let's read it. 39 weeks of pregnancy, patient is in labor. Okay, oxygen is given by mask, IV through IV, syntocin, thus oxytocin has been given. Okay, we have the CTG. The CTG shows the heart rate of the baby 140. Normal is 110 to 160. In some guidelines, they say 120 to 160. Now it suddenly dropped to 70. Why? Oh, good. So look at here, came back to 140 again after 2 minutes. Appropriate next management. Stop the offending agent, whatever it is, guys. It's not normal. So what is the offending agent? What has been given to this? Syntocin. Okay, so you have to stop it. Okay, this is the answer. Why? Because we do have the side effect of syntocin. This is again from John Montauk. For the baby, irregular heartbeat. We could see irregular heartbeat because it was 140, it dropped to 70. So for the mother, uterus rupture because it will cause a lot of contraction and hypertension to the mother. Okay, let's go to the next question, guys. This is your next question, 30 seconds. All right, 30 seconds up. Okay. Okay, guys, let's see. What do we have here? Pregnant lady. We do have VZV, IgG, which is negative. Okay, which is negative means that she has not never had varicella zoster virus. Okay, and she never had vaccination either. That's why IgG is negative. Okay, so what should we do now? Nothing, because she's negative. So no need to give her any vaccination. Okay, let's check the answer. Okay, we do have like no need for vaccination now. Okay, okay, look at here. There's information from John Moffatt, guys. We do have congenital rubella syndrome, varicella in pregnancy, and we have like skin scarring, limb defect, ocular anomalies, neurological malformation, the risk of highest to second trimester. Okay, this is for you guys to read. Okay, and the highest risk is where? When the patient has contacted 5 days before the birth and 2 days after. This is the highest. Okay, so this is for you guys to read it, okay, for more information. I'm going to share the slides. This is the next question. 30 seconds. Okay, we have A. Okay, guys, let's see. The patient has using anticoagulant, want to use anticoagulant after 6 weeks post-delivery, guys. So this question, as you said, like in the exam, you never get like this kind of question. Why? Because it's very short. You get a paragraph. So you have a lot of information, like how much what she was using before, but we do have this information at the moment, so let's deal with this. So post-delivery, guys. So most of you give A. So I don't know what is the condition of the patient. We don't have any clue. A. Okay. So let's see what the John Moffatt says. John Moffatt says warfarin is much better option than low molecular weight heparin because the mother most likely is doing breastfeeding. But if you have in a question that in the STEM that the mother is not breastfeeding and doing formula feed, you can go with low molecular weight heparin. Okay, no worries. Why warfarin? Because warfarin is better because it's not secreted in the breast milk, while low molecular weight heparin is secreted in the breast milk. Okay, guys. Thank you very much. That's me. Everything is hopefully fine. So this was 15 questions. I really loved it to solve with you guys. Okay. So if you have any questions, I'll share my WhatsApp and we will make a WhatsApp group for you guys and you can ask your questions there.
Thank you so much, Dr. Farhat, for this informative session. Now, I would like to tell about the features of our recall workshop. So, the recall workshop is starting from 15th of January, and we will be having Dr. Farhat and Dr. Amdul as your expert mentors. So, in the recall workshop, we are going to have 6 live sessions in which we are going to discuss about the recall questions. Apart from this, we're also giving you Q Bank that will be topic wise. Okay, so this is the schedule of the full course. So first of all, we're going to conduct orientation session in which we are going to tell you how you're going to go with the flow about the course, how you're going to access everything on our website, on our application, everything. Okay. So we will be giving you topic tests on a daily basis, and every topic will be given to you according to the schedule. We will be having 3 quizzes in the study group, and in the end, we will be having mock exams that will be according to the AMC exam. We will share our links in the chat box so that you can have a look. Apart from the workshop, you can also join our question bank we have 3 monthly plans, 3-month plan, 6-month plan, and 12-month plan. You can join according to your need. There will be 1400 plus questions, and we will be giving you explanation with every single question. So this is the surprise for all the students who have joined us today. We are going to give you $30 off on a recall workshop. And if you want to join the Q Bank only, then you can get it for $120. If you have any question, if you want to join the course, then you can directly message us. Our team is going to help you out for the guidance. Also, if you want to join as a group, then as a group, you can get amazing discounts. So that was all for today's webinar. Thank you so much all for joining us today. Thank you so much, Dr. Farhat, for this amazing webinar.
Thank you very much. It was my pleasure. Thank you, guys. If you have any questions, please feel free to ask me in the WhatsApp group, okay? Thank you. Have a good day. Bye-bye.
Thank you so much, everyone, for joining us today. Take care. Bye-bye.